It's time for Kadlec on Call on News Radio 610 KONA. It's your chance to learn valuable health information right here in our community. Now, the host of Kadlec on Call, here's Jim Hall.
And a good Wednesday evening, everyone. Welcome to another edition of Kadlec on Call on a cool Wednesday evening in the Tri-Cities. The temperature beginning to drop. It's certainly feeling like fall, although it was a beautiful Wednesday here in the Tri-Cities. And we thought we'd take the opportunity as the calendar shifts into the month of November. We wanted to spend a night learning and teaching you and educating you on the importance of staying healthy and getting exercise, even when the weather isn't as nice. Even when perhaps the snow flies, you may be getting ready for the ski season, you may be getting ready for whatever winter activity you like to do. And so we wanted to spend tonight bringing some expertise in the orthopedic world into our studio. We're going to have some via phone later, and we're also going to talk about the type of treatment and care that you need should you have to face a joint replacement, whether it's a hip surgery, a knee surgery, or even a shoulder surgery, a shoulder replacement surgery. So we have a lot of expertise in the orthopedic world with us tonight. Live here in the studio is Dr. Josh Miller and Dr. David Gibbons. They are both orthopedic surgeons with Proliance Northwest Orthopedic, located in Richland and Kennewick, but primarily over in Richland next to the hospital at Kadlec. And they are here to spend some time sharing their expertise on everything from sports injuries to, I guess, relating to kids and high school age kids and teenage kids and things like that. But for people of the older population, if you're trying to stay fit and making sure that when you go out and exercise once real hard, that you want to come back, even though you're feeling pain the following day or two, to make sure that you can sustain that exercise. So a lot of ground to cover tonight. We wanted to spend that time with you. And first, why don't we begin with Dr. Miller, because he's newest to the Tri-Cities. I want to give each of you, Dr. Gibbons and Dr. Miller, an opportunity to just provide a little background about how you ended up in the Tri-Cities and a little bit about your medical background as well. So let's start with you.
Well, thank you. I appreciate you having me here tonight. So kind of give a little background about myself. I did my medical school training at UCLA in California, at Los Angeles, had an exceptional experience there, and then went from there to did my residency training at the Campbell Clinic, which is a big orthopedic institution in Memphis. Some fun facts about that place is that it's actually the birthplace of the American Academy of Orthopedic Surgeons. It was started there by Willis Campbell. And since then, they've had more presidents of the American Academy of Orthopedic Surgeons than any other place. And it's also where Campbell's Operative, which is the most widely published orthopedic textbook in the world, actually is published, and the staff there write that book. And so it's a 4-volume set, so
wow.
it's more than just a book.
It's an exercise program unto itself.
Just carrying those books around. But so I went there, had a wonderful time there training, had some wonderful mentors there that helped me develop as a surgeon. And then I went to Washington University, did an additional year of fellowship specifically in sports training. And while I was there working with the university there, I was also one of the team doctors for the St. Louis Rams as well as the St. Louis Blues to get some experience working with professional teams and particularly focusing on different sports injuries.
Okay, who's tougher, football players or hockey players?
That's a great. They're both tough, but hockey players, I got to say, those guys. They get excited when they break their teeth.
Sure. So how'd you end up in the Tri-Cities?
Well, I was looking around at some wonderful opportunities, and to be honest, the surgeons at Northwest Orthopedics is really what made the difference. I was looking at some different groups, and I came here and interviewed with and talked and met the surgeons in the group here, and what really stuck out to me is you had a group of surgeons here that all were exceptionally trained, were very talented, and had the same philosophy that I do, and that is that the patient comes first. Mm-hmm. That treating the patient and providing excellent, exceptional orthopedic care in a community is the primary goal. And I think, while a lot of people play lip service to that, it really shows, starting with our founders, Dr. Zirkel, who's done wonderful work throughout the world, made putting the patient first the center, the motto of our of the practice. And to me, that's what I was looking for. In addition to that, I've got 4 kids, and And this is just an exceptional place for families. It's got a great community atmosphere, and we just fell in love with the community. Dr.
David Gibbons, also part of that Northwest Orthopedic practice, and I know you've been here a few more years than Dr. Miller, but what was it that, first of all, I guess give a little bit about your background, but how'd you end up in the Tri-Cities? Similar stories as far as why?
Similar. By the way, thank you again for allowing me back.
A return trip for you.
Apparently, yes. I didn't scare you away.
You were awesome last time. Yeah.
My training, a little bit about my training was I did my medical training at Dartmouth Medical School in Hanover, New Hampshire, kind of a little bit more of a rural medical school, and from there I went to the Medical College of Wisconsin in Milwaukee, and did an orthopedic surgery residency there. We really weren't looking to move too far for a fellowship. I knew I wanted to do that training. I did an extra year in shoulder reconstruction and sports medicine, and so we stayed in Milwaukee with the private group there. They're affiliated with the Midwest Orthopedic Specialty Hospital, Orthopedic Institute of Wisconsin. Had a great year there, getting more hands-on and excellent training in shoulder reconstruction and sports injuries. And then as far as coming here, similar type of story as Dr. Miller. We're originally from the western half of the United States, although we've been all over as a family, and we just decided we wanted to head back this direction, and the opportunity opened up here in the Tri-Cities. A great group of surgeons to work with, great community, great. And when I say community, it's the people, the schools, the atmosphere, just a great place to bring the family in.
Now, I heard you did a specialty, a fellowship in shoulder. Is that something that is kind of your surgical specialty, although you do other types of joint replacement as well?
I do. Primarily, I would say probably 75 to 80% of my practice deals with the shoulder and different pathologies around the shoulder, whether it be arthritis, fracture, sports injuries, as we'll talk about a little bit later. But I do primarily, I won't say primarily, but the bulk of my work is around, in and around the shoulder.
And Dr. Miller, how about in your instance?
I probably split my time a little more evenly between the knee and the shoulder. Probably maybe even a little more toward the knee. Probably 60% of my time spent in the knee and more in the shoulder. But then, like Dave, we also do other areas: the elbow, the ankles, really any hip problems, any kind of orthopedic issue. Certainly, we can address and help deal with.
In this time of the year, a question for both of you, obviously, is the sports season, and I'm not necessarily trying to zero in on the high school season, but is it during the fall sports season? Is it more football work that you do, or is it just a combination? I would imagine, soccer is obviously very big in this community as well, so I would assume that keeps you guys pretty busy as well. Break that down for us. Is it seasonal as far as the type of cases that you see in your practice? Or not?
Well, I would say certainly, I think nowadays more than ever, you've got people who are playing sports year-round. I think you do see different sports, but the injuries, unfortunately, keep coming. Certainly you see more football injuries, a lot of soccer injuries as well, cross-country injuries during the fall where you're seeing those sports. But again, as people are playing sports year round, we still continue to see baseball. Some more of the spring type, and then like we talked about earlier, that kind of maybe covers more of the younger athletes. But certainly, you've got people who are doing more competitive athletics even as they get older, and you'll see the people that are playing. Your triathletes. And people that are doing CrossFit, all sorts of different sports that really are year-round. And so you've got a constant flow of people that constantly have orthopedic problems. Unfortunately, I guess you could say, you don't see a lot of fluctuation. It's pretty constant.
And I was going to say the fact that the older we get and, people are living longer and it seems like maybe hopefully we're getting healthier and trying to stay healthier and fit longer. So as in your orthopedic world, I would assume if somebody's in their 40s and 50s and spent even it's just an entire life on their feet, they're going to have those types of things. So all the more important if they want to stay healthy and stay fit to make sure they're taking care of their bodies from an athletic standpoint.
I agree with you there. And like Josh said, it is year round. It's a year round event. I would never call anyone old. I get patients who come and say, I'm too old for this, and I look at them and say, you're active, like he mentioned, you're active in running, you're hiking Badger every day, or you're out doing the triathlons, you're on your bike,
that's true.
swimming. Someone like that, in my opinion, old is a state of mind, less a state of body. And our goal is to allow not only the high school athletes, we also help cover the Tri-Cities Fever when they're in season, but our goal is to help the athletes, the formal athletes rather, maintain their sport and their activity. But those who are lifelong athletes, our goal is to help them maintain that activity level
wherever
throughout whatever age category they fall into. Yes,
that's Dr. David Gibbons, along with Dr. Josh Miller, orthopedic surgeons with Proliance Northwest Orthopedic here in the Tri-Cities, and we're here tonight talking about some of the great work they and their colleagues are doing here to keep all of us fit, and especially as we try and stay active, as they said, no matter what the age. When we come back, we want to delve a little more deeper into the joint replacement work that they do, whether it's hips, knees, or shoulders, and we're also going to introduce a guest from Kadlec Regional Medical Center to talk about the program that they provide in support of the surgeries that these physicians do on a daily basis here in the Tri-Cities. Have to take our first break of the evening. We will be back with more of Kadlec On Call in just a moment.
You're listening to Kadlec On Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Kadlec On Call. Here again, Jim Hall.
And continuing our discussion on orthopedic surgery and orthopedic care. For all of us, no matter what our age, whether we have children who are playing sports around the busy Tri-Cities, or they're a little bit older, like many of us in this room, at least the person on this microphone, who want to stay healthy and making sure we can do so in a way that keeps our quality of life what we want to be. But in the studio, we have Dr. Josh Miller and Dr. David Gibbons, who are orthopedic surgeons with Proliance Northwest Orthopedic here in the Tri-Cities. And we also have with us live in the studio is Tracy Moran-Patton, who is the manager of Kadlec's Joint Care Center. And in our first segment, we had Dr. Miller and Dr. Gibbons talk a little bit about the type of surgeries they do, and a lot of their practice is devoted to joint replacement. And so Tracy takes care of when the patient comes to the hospital, even before they come to the hospital, but obviously helps put all that together. Dr. Miller touched on the patient-centered aspect of the practice at Northwest Orthopedic, and certainly I know it's alive and well at Kadlec as well with the Plane Tree philosophy of care, and I know Tracy embraces that quite wholeheartedly. But Tracy, why don't you share a little bit for our listeners from your view of how the work that you and the nurses and the staff at the hospital do, not only from the care once someone undergoes surgery, but preparing for surgery from an educational standpoint as well.
Well, it's really our privilege to work very closely with the surgeons. Where we come into play is once the case is scheduled, we automatically know that they're coming and have a process in place where patient registration is calling the patient and getting them scheduled to come in for a pre-op class, their pre-admission services appointment, which is really having them cleared for anesthesia and making sure that they're as healthy as can be prior to surgery. Once they come and have their surgery, then we have a whole team that is prepared to care for them, from case management, physical therapy, occupational therapy, of course, our nursing staff. And what we're finding is that patients are prepared to go home usually at right around 2 days, sometimes less than that.
2 days, wow.
When they transition home, they get a phone call within about 24, 48 hours, and that's from a registered nurse. And that nurse is asking them questions specific to their surgery and ensuring that if there's any concerns, that we can guide them toward the right route and resources. You
said this pre-op class, so you'd go over basically from A to Z what they're going to see when they come into the hospital, see and experience and all of those things?
Right. Our pre-op class is run by registered nurse and physical therapist. So it lasts about an hour and a half, where the patients are also given, prior to coming, a very nice comprehensive guidebook that walks them through the steps, what they can expect. And then the nurse and the physical therapist really take it a bit further. And it's not a large class. We hold it once a week and hold it for separate for hips, for knees, shoulders, and they have that one-on-one time with the nurse and with the physical therapist to walk through what to expect and how they can best prepare before and for after surgery, and also what we're going to be doing to help minimize risk for complications and along each step of the way, and what they can be doing to partner. We're partnering together to keep them as safe as possible as they transition through the surgery.
Dr. Miller and Dr. Gibbons, a question I guess it begs to you is, and maybe back up a little bit from prior to the pre-op class that Tracy has, the determination for a joint replacement from your view, obviously that must happen in your consultation when they come in and make that decision and consult with you. How important is that teamwork with the hospital staff, the nursing staff, once you've made that determination with a patient to go forward with a joint replacement, whether it is a shoulder, a hip, or a knee?
For a good outcome, that's critical. As you mentioned, it starts in the office when a patient comes in for an initial consultation. We'll talk to them and run them through all the options of treatment, non-operative and operative. And when it comes to the time where their joint is affecting their lifestyle, I can look at a set of X-rays and say, yeah, you're a candidate for a shoulder replacement or a knee replacement. But if a patient's not having pain or it's not affecting their lifestyle, they're not ready for it. It's when a patient comes to me and says, we're ready for it. And then, as Tracy mentioned, we contact the hospital and make arrangements for the surgery. And from that time, it is a collaborative team effort. The patient is the center of that team. But all of us are there to do our best to make sure they have the best experience. Obviously, there's going to be some pain and some trouble involved, but to have the best overall experience they can in going through their joint replacement and the rehab afterwards. Mm-hmm. The joint replacement itself is only a small part of the whole process.
And do you go over that? I'd be interested to hear Dr. Miller's take too, but do you go, I'm guessing you go over that. You're obviously very realistic with these people that, when you're doing something as invasive as a joint replacement, there will be pain. It won't be easy. I mean, so it's important that the realism is part of this as well.
I do, and one of the statements I jokingly tell patients is they're probably not going to like me very much for about 2 months after their surgery, and hopefully about the 2-month point they're starting to say, "Okay, Dr. Gibbons, I like you again. I'm glad you did this procedure for me because things are turning better for me."
Yeah, I would agree with Dr. Gibbons. This is a life-changing surgery in a lot of very positive ways, but at the same time, it is a big surgery. It is a lengthy recovery that often has a significant amount of pain involved. And I think that one of the things that, particularly with us working in collaboration with Kadlec, is allowing the patient to understand and better anticipate the challenges and the process that the total joint will involve. And so there's a lot of education that goes on in the process. This is not something that you come in, and we rush you into surgery the next day and say, hey, we're going to do a knee replacement. This is something that we help plan out together, allow the patient, like Dave was saying, is the center of that team, and help them make all of the changes and prepare for that big life-changing event, which is their joint replacement. And yes, the recovery can often be painful, and we try to help anticipate all the questions they have, help anticipate for them what that recovery will be like. The better we can help them realistically understand the expectations, the better they can do in their recovery process, and they can get back to doing everything they wanted to do and have the outcome they hope for. And one thing I've found is that education helps resolve a lot of the concerns, a lot of the worries, and makes the process very smooth. So working collaboratively with Kadlec does a wonderful job of helping to provide that education, helping patients anticipate what their joint will be at the end of the process of recovery, and help that process be a smooth transition rather than filled with lots of bumps and problems and trials.
I was going to say the fact that, as Tracy described, what the patient would experience within the hospital setting, it always used to not be that way in medicine, did it? I mean, you guys are relatively, I guess, young in the physician world, but probably say when, Dr. Zirkle, when he and Dr. Samsel and those doctors of their vintage, they were probably rare having this philosophy of care that, it's not as holistic maybe as it is today, and that's a good thing for patients, I would think, to be able to have that education, that collaboration, that support system from the entire team start to finish.
That's one thing I think that, again, going back to what drew me to the area, Northwest has had a long history of a philosophy that centers around the patient, and it is a very holistic approach in the sense that, yes, if it's not just fixing the bone problem, it's helping that person recover to get back to doing whatever they wanted to do. And that doesn't just involve fixing the arthritis, but also helping them anticipate any problems, whether it be with at home or at work, needing therapy, working together as a team with all of the other healthcare providers to really optimize their experience. And it really is a community effort of people working together to help that patient have a great outcome.
Tracy Moran Patton, we have a minute before we have to go to our next break, but at the Kadlec program that you oversee, when a patient comes in for a joint replacement, you touched that physical therapy is a part of this and a key part of this. I know you have the team there with those patients very quickly right after that surgery, which even though they're in a lot of the pain, is the goal to get them up and around and moving as quickly as possible?
Absolutely. In fact, the goal is to have them up, have a physical therapy evaluation and treatment the day of surgery. Right now, over 80% of our patients are having day of, and over 99%, almost 100, are within 18 hours of surgery. And what we're finding is if we can get you up and moving, you're going to do so much better. Your systems are going to get moving quicker, and it actually helps with pain control as well. So. And
then you follow up, mentioned once they are sent home to recover, then there's that follow-up as well, because I would imagine that's a critical time.
Well, and that's really guided by their surgeon as far as outpatient therapy. Right now, 93% of our patients are going home with outpatient therapy and doing really well.
And I know before we have just a second, but I want to touch on this as well, but I know, we hear about all kinds of accreditations and certifications and things like this, but I know there's an organization called the Joint Commission that accredits hospitals and various services, and I know Kadlec has a very prestigious gold seal of approval for its hip and knee program, and that's because of quality outcomes and all of those things you're just describing, correct?
Correct, yeah. It's a very rigorous certification to attain, and you have to recertify every couple of years. So we're excited to have that. We worked very hard to get that, and are also looking to add shoulder to that, hopefully by beginning of the year.
Awesome. Have to take our bottom of the hour break. We're talking about orthopedic care, whether it's shoulders, knees, hips, and just general overall physical fitness and exercise if you're out there wanting to take part in activities throughout the year. Have to take our bottom of the hour break. Back with more of Kadlec on Call in just a moment.
You're listening to Kadlec on Call on 610 KONA. This program provides general information only. Any comments or information presented are strictly for educational purposes. Kadlec and 610 KONA do not endorse any of the suggestions made by the presenter or callers. Now back to Kadlec on Call. Once again, Jim Hall.
And welcome back to Kadlec on Call. Tonight we're spending our hour visiting with some experts in joint replacement care and orthopedic care, and they are all from Northwest Orthopedic Proliant surgeons here in the Tri-Cities. We've been visiting the first half hour with Dr. Josh Miller and Dr. David Gibbons, and now we're going to go to the phones because one of their colleagues has been very busy doing surgery all day, Dr. John Staley. He's been a guest of our program on a couple of occasions previously as well, and Dr. Staley, I think, just finished a busy day in the operating room. So how are you, Dr. Staley?
Good.
Glad to have the day over with.
Yes.
I was going to say, maybe for our listeners, how many cases did you do today? Let's just start with there. Talk about, without obviously you can't share the specifics of the patients, but give us a slight overview of the types of cases you did in the operating room today.
So 3 total knee replacements. These were primary total knees, and then one revision knee replacement.
Now, so that's a case. How early? You must have started early then.
7:30.
7:30. Give us an idea. We've been talking about some of the innovations, and Dr. Gibbons and Dr. Miller and even Tracy with the hospital, the team approach to how you approach joint replacement care now, and making sure that the patients are really prepared when what they're going to experience either before, during, and after, and when they go home for surgery. I know you've been practicing in the Tri-Cities a number of years. Maybe give our listeners an idea of how it's changed with the types of patients that you take care of, say those maybe 10 years ago and those that you took care of today, as far as what they would experience.
I think the changes have been pretty dramatic and include better patient preparation, improved pain management in the hospital, and a better systems approach to total joint replacement. And I think Tracy may have touched on that with our joint care program. And I think those have probably been big advancements, trying to get patients better prepared for surgery from a standpoint of physical preparation, mental preparation, if they have to quit smoking, get their diabetes under control, weight under control. All of those things have helped to decrease complications and readmissions, and makes the recovery for the patient much easier. And then I think our ability to manage pain has been improved greatly in the last few years, and that's made an incredible improvement in patient outcomes and decreased length of stays in the hospital. And
let's maybe touch on that pain management issue, and your colleagues are sitting here listening to you, and maybe feel free to all jump in on this one, but you touched on how pain management has helped, and I know Tracy touched on the fact that once the patient's case is done, as soon as they're coming out of surgery, you start that process right away, so you have some techniques now available that maybe you didn't, as far as allowing the patient to advance quicker and get out of the hospital and back home?
Correct. It actually begins before surgery, so they get multimodal pain management, we call it, and it begins with preoperatively giving some medications that will help with postoperative pain, and then some local injections of medications and local anesthetics that help with the immediate postoperative pain. I think the spinal anesthetics help that, and then for the total knee patients, these nerve catheter blocks have made a tremendous difference in pain management. I just made post-op rounds this evening on two of our total knee patients, and they were having no pain whatsoever in their total knee, and that's because of the blocks and the perioperative and the preoperative pain medications that have been administered. They were up and walking and moving their knee, and just made a tremendous difference in their own mental approach to how they're going to recover. They just said, "Wow, this is totally different than they expected."
And is that a case of where it's just because it's and I don't want to get too medical, but it's blocking the pain, so mentally they're more together to where they can focus on, if they're not experiencing the pain, they can be focusing on the rehab?
Yes, and the pain management techniques have been such that they don't inhibit the muscle control. So they're able to move their leg and walk and do that immediately without experiencing the typical postoperative pain that we used to see 10 years ago.
And so what you're saying then is that allows them to actually leave the hospital sooner? Maybe
Correct.
Contrast that. What's it like, say, today on a best case scenario, and maybe 10 years ago when you did a total knee?
So 10 years ago when we did a total knee, the patient would be in moderate pain for the first few days. They'd probably stay in the hospital 3 to 4 days. 20 years ago, they used to stay in the hospital 7 to 10 days. Wow. Now they're staying 2 days, and they're going home with a pain catheter pump that really decreases the need for narcotics. Doesn't eliminate it, but it significantly decreases that. They're much more mobile, comfortable, and it's just made a tremendous difference. So the length of stay now for our total knees is probably 2 days. Wow. For our total hips, our anterior approach total hips are probably going, about 50% are going home the next day.
Wow.
And the others are probably going home in 2 days. So, 2-day length of stay is a tremendous improvement from 10 years ago, where it was probably a 4-day length of stay.
And I was going to say, I'm not so much the, we're here to, the quality of life is where, but, we all hear about the cost of health care. And obviously, if you're in the hospital 2 days versus 3, 5, 10 days 20 years ago, just that alone from a financial standpoint is going to make a difference. But, I guess the quality of life, I saw Dr. Miller had something that you said, Dr. Staley, that he wanted to expand on. So, Dr. Miller?
Well, I was just going to add, I think, as we talk about length of stays particularly, the big thing here is these patients are ready to go home. Like Dr. Staley had mentioned, often I'll walk into my patients' rooms the day after or 2 days after surgery, and they say, "Doc, I'm ready to go. Can I get out of here?" And they're itching to go. And so I think it's the ability to get the patient ready, and they're ready and wanting to go home. Their pain is well controlled. They're mobilizing. This is something that they feel ready to do.
And how often, we have to take a break in a moment, and when our last segment, I wanted to spend some time and talk about the importance of that mental approach that you touched on, because certainly from the education standpoint, being able to know what to expect and then having that positive mental attitude is huge, I would imagine, in this type of thing. But from the case when the patient leaves your care, when do you see them? I mean, if they're not having complications, will you just maybe have a follow-up appointment a week or so later after the surgery?
We typically see patients at about 2 weeks post surgery, and then again at 6 weeks post surgery.
And then they're also they're primarily just beginning that physical therapy regimen. Is that usually what happens? They're assigned some physical therapy to do to really.
Usually within 3 to 4 days after discharge, they should be starting outpatient physical therapy.
And really, and again, I'm sure every case is different, but. Say this total knee case that we're talking about, how soon, weeks, months, will they start really seeing that noticeable difference or becoming friends with Dr. Gibbons, as he mentioned, again?
So, it's variable on total knees. If you look at the statistics, there's a real wide bell curve on when patients feel better. But I think with the newer techniques, patients are feeling better quicker. But it varies from patient to patient, and the full recovery, can be 3 to 6 months. But by 2 weeks now, we're seeing patients that are just doing incredibly well and already feel like their preoperative symptoms have improved. Where 5 or 10 years ago, it used to be 6 to 8 weeks before we'd see patients express that.
Sure. That's Dr. John Staley, an orthopedic surgeon here in the Tri-Cities. He's on the phone, just finished a full day in the operating room with some joint replacement cases. His colleagues, Dr. Josh Miller and Dr. David Gibbons, are here in the studio with us, along with Tracy Moran-Patton, who manages Kadlec's Joint Care Center. We have to take our final break of the evening. We're going to get back and talk about that mental approach, I guess, whether it's you're facing joint replacement surgery or any type of major surgery. From the physician standpoint, the importance of having that positive mental attitude. We'll do that when we come back in our remaining minutes of Kadlec on Call in just a minute.
You're listening to Kadlec on Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Kadlec on Call. Here again, Jim Hall.
And just a couple of minutes left talking with our guests tonight, 3 orthopedic surgeons here in the Tri-Cities, and Tracy Moran-Patton, who manages Kadlec's Joint Care Center. Dr. John Staley has been kind enough to join us tonight after a busy day in the operating room. And Dr. Staley, before we let you go on the phone, I did want to touch on, from your view, that approach, and you talked on, that this is a joint replacement can be very painful, and it's not easy for the patients that you have that have to endure this. How important is the mental approach that patients have when they come in and see you guys in the operating room and make that decision to have a joint replacement?
Well, I think it's very important that the patients are engaged and have a positive attitude towards their recovery, and that their family is very supportive of that. I think it's really a key point in people being prepared both mentally, physically, to proceed with the procedure, because it can make tremendous improvements in people's function and daily activities and things like that, but they have to have a positive attitude in order to really undertake that and get going with it. And it's a lot of education and preparation and setting their expectations that they have a good team and people to support them and to deal with the pain management, and really setting their expectations for what this is going to entail. And I think once that's done, I think people start to say, okay, I can do this, and I've got a good supportive system that's going to help me through that.
Do you find with your patients, I would assume, do they reach that kind of, not to use the Rocky Balboa moment, but, when that, they've grinded through and they're hitting that surgery, and all of a sudden they come in and say, all right, doc, I can do this. That probably happens at different points along the recovery way?
Definitely. And I think some people also, hear a lot of bad stories and are kind of biased in some way that's going to be their course, and they may have heard this, years ago. And I think joint replacement has changed tremendously, and the majority of patients will do very, very well. It's just that they have to be prepared mentally to accept that challenge and understand that they've got a good system that will help them through that.
That's an interesting point. And Tracy Moran-Patton, who manages Kadlec's program within the hospital, I know it's vitally important. You touched on that support team, Dr. Staley and Tracy. I know it's passionate in your heart, is making sure you have someone with you if possible, whether it's a spouse, a loved one of some kind, is to play the role of what you call a care partner. Talk a little bit about that.
Absolutely, and that we didn't really speak to that earlier, but it's imperative that we have what we call a care partner. That's someone that the patient selects who will be alongside them every step of the way. And in fact, we just had a pre-op class today, and we asked for our patients and the care partners to give us feedback, and we received feedback from a care partner that said, we have been dreading and very anxious about this surgery, and feel so much better now that we've had an opportunity to spend time with the nurse and the physical therapist. So it really brought home to me that it's not just for the patient; it's a family deal when we're having this type of surgery, and we really we want that care partner alongside the patient the entire time,
all the way through. And I guess it all goes back to that original point that our physicians that attracted them to the Tri-Cities was that philosophy of care. And I guess Dr. Miller and Dr. Gibbons will let you finish. We have just enough for maybe each of you to make a comment is on that point, is the fact that it really does contribute to a better quality of life in those recoveries, to being a participant in that care, does it not?
Yeah, I think certainly the whole preparation, the whole team working together, to me, one of the things that really drives me as an orthopedic surgeon and makes me love my job and what I do is seeing how much of a difference these surgeries can make in someone's life as they work together with the team to get them back. I mean, it is absolutely amazing to see people that had very limited function, a lot of pain, and were really just grueling through each day, come in smiling, happy, talking about the great vacation they had. They just got back from being able to go hiking, go walking, going back to doing the things they love. And really, to me, that's one of the things that drives me and is exciting to see these people finding the joy in life as their pain is controlled and they're able to do what they want to do.
Dr. Gibbons, you get the final word.
Well, I would comment on the team approach, being that's something that we really work on in this day and age. But that's something that there's been a long-standing tradition in orthopedics. We mentioned earlier the Dr. Samsels and Dr. Zirkles, and that generation of orthopedists started all this. With their research and their desire to to allow patients to have good outcomes. We continue to build on that with these pain catheters and the care partners. And this is a lot of it's come from the outpatient world, where we used to see that, for instance, an ACL surgery was an inpatient surgery where someone would take a couple days, or rotator cuff surgeries likewise. Now these are outpatient surgeries where they come in, their surgery's done, and they're out of the outpatient center within a few hours even. Again, building that mental approach, having the global, the pain control, the care partner, just being prepared. The goal is to make this a positive outcome for people, so that they will, after going through this once, if they need it a second time, they'll be willing to say, yeah, it was not such a bad experience as what I've heard. I'm willing to put my life on hold again and have the best outcome I can.
Well, on that note, we want to thank all of you for taking time to share your expertise and allay maybe some of the concerns that people might have, whatever the joint replacement case they may have. Dr. Staley on the phone, Dr. Miller and Dr. Gibbons here in the studio. Tracy, as always, thank you for your help. If you'd like more information about Kadlec's Joint Center program, you can go to kadlec.org/joint replacement. And also it has biographies of not only the physicians that we talked about, but all of the physicians practicing within Northwest Orthopedic in the Tri-Cities as well. Thanks for listening to Kadlec on Call. Have a great week, and we'll see you right back here next Wednesday evening.